if you go back about 100 years, people for the most part did not need their wisdom teeth removed. And then if you go back to the more primitive cultures, for example, there's an author by the name of Dr. Watson Price. It's a pretty classic book that a lot of people talk about. He was a dentist that traveled the world in the 1920s and 30s. He and his wife was a nurse. They traveled all 5 continents, looked at these indigenous cultures. And they found that across the board, as long as they were eating off the land, so it could be off the mountains and the oceans and the jungles, and oftentimes just 2 or 3 food groups, not 4 food groups. They had perfect teeth and no cavities.
Well, thank you for doing this, Dr. Stephen Parker, the author of Sleep Interrupted. You are an ENT surgeon and a sleep doctor, but can you explain how those two areas of medicine intersect? Because to most people, it wouldn't be immediately obvious.
Yeah, so I started off my career about 25 years ago as a general ENT surgeon. And what I realized was that many of the problems that ENT patients suffered from were related to poor breathing and poor sleep. So for example, if you have sleep apnea, you're going to vacuum up your stomach juices into your throat through acid reflux. And what they've shown is that the stomach contents can go into your ears, sinuses, nose, and your lungs, causing inflammation. So when I addressed that particular issue, many of the other common ENT problems got much better. So that's why I
Okay,
got interested in sleep.
you mentioned sleep apnea there. Generally speaking, can we just define exactly what sleep apnea is and then the forms of treatment and possibly lifestyle changes which might be recommended?
So the term apnea just means that you stop breathing. But sleep apnea is a very technical term based on a sleep study where they hook up to all these wires at night. And the simple explanation is that you stop breathing completely for 10 seconds or longer. So that's called an apnea. And then you have partial obstruction that lasts for more than 10 seconds. And those are called hypopneas. So when you add hypopneas plus apneas, divide by the total number of hours, that's what you get as the AHI, or the apnea hypopnea index. That's the severity of the sleep apnea condition. And you need at least 5 or more to say you have mild sleep apnea, then moderate and severe as the number gets higher. And so this is a very common condition. And studies have shown that even maybe 20, 30% of the people will just have it without knowing it. In certain populations, over 50%, especially if you're overweight. But they estimate that about 80 to 90% of people don't know that they have sleep apnea. They just kind of live life not knowing it, but it causes other complications such as high blood pressure, diabetes, memory problems, digestive issues, anxiety, depression. The list goes on.
And of course, as far as you're concerned, then that would affect their ability to get good quality sleep, and then they would obviously be very tired and just feel poorly then the following day after having endured a night bedeviled by sleep apnea.
And you can even not snore at all and be skinny and still have sleep apnea. And that's the problem that most doctors still think that you have to be this overweight snoring man, middle-aged snoring man to have sleep apnea. But there are lots of women, young, thin women that don't snore and still have sleep apnea.
And we develop, or do we develop sleep apnea as adults, or can children suffer from sleep apnea too?
Oh, it starts from after you're born. But in children, the peak happens around ages 4 to 6. That's when the children need tonsils removed because that's the most common reason for sleep apnea. But it's not, it gets a little bit oversimplified with tonsils causing sleep apnea because ultimately, this is what I talk about in my book, that just because of modern humans' jaws getting smaller and smaller, just not growing properly, that's why we have more dental crowding. It also narrows our airways. And when that happens as a child, you bring up your stomach juices that cause your lymphoid tissues, like your tonsils, to get bigger and bigger, causing more apneas. So it's like a vicious cycle.
I want to come back to the changes in the anatomy of the skull in a second if I can, but if I can broach the subject of upper airway resistance syndrome. Now, I hadn't heard of this term before I did some research for this interview. How does that differ from sleep apnea? Because I know it fragments sleep also.
Yeah. So this is my main area of concern. I mean, sleep apnea is pretty well known out there, and all the treatment options are pretty standardized. The problem is that most doctors, especially sleep doctors, tend not to recognize that UARS, or upper airway resistance syndrome, exists. And the way it's defined is basically if you don't meet that threshold of 5 apneas or hypopneas per hour, and you have symptoms, then you're diagnosed with upper airway resistance syndrome. So let me just give you an example. Apnea means you stop breathing for 10 seconds or longer. But let's say that you stop breathing 25 times an hour for 9 seconds each. Then your score is going to be 0, but your sleep is fragmented 25 times every hour. So you can't sustain deep sleep.
And I suppose then you're not getting any recovery or restorative effects that sleep would normally confer if you're having such a fragmented sleep every night.
Exactly. And your symptoms are going to be a little bit different than your classic sleep apnea patients. Typically, it's going to be headaches, fatigue, anxiety, depression, digestive issues, low blood pressure, cold hands, cold feet, hormonal imbalances. So that's a little different list of symptoms as opposed to your classic sleep apnea patient.
Okay, so let's talk again about the skull and the changing in the skull's anatomy. I spoke to a doctor recently who specializes also in sleep apnea, and he was saying that our skulls have changed over the last 50 to 100 years, in part as a result of the way infants are being fed. A lot of them are now, rather than being breastfed, are being bottle fed. And it seems then this is having a knock-on effect then later on in that the mouth and the oral cavity is developing differently. Would you agree with this?
I totally agree, but I would add many more factors on top of that. And as I progress, as I practice every year, I add a couple more factors. It's multifactorial, obviously. And bottle feeding is definitely a known documented risk factor for dental crowding, but also pacifier use, soft diets. So modern Western diets are softer, so we're not chewing and using our muscles as much. Nasal congestion, for whatever reason, if you're a mouth breather, the jaws don't develop fully. And then what else? Oh, toxins and chemicals, endocrine disruptors, all these things affects bone and cartilage and jaw development. If you actually look at these pictures of these movie stars in the 1920s and 30s, notice that the jaws are much wider. They look like aliens, right? Compared to now, the celebrities have these triangular jaws. And there was actually a paper that came out about 20 years ago. They looked at facial smiles, looking at, I think it was high school, college yearbooks, compared from the 1900s on to the 1980s, 90s. It's really remarkable how narrow the modern faces are now, taller and more narrow.
Going back to sleep apnea there, yeah, you made a reference in one of your previous interviews to a eureka moment. This was when you read a paper by Dr. Terence Davidson, which linked the development of sleep apnea to our ability to talk. Can you give us more
Yeah.
details on this?
Yeah, so this is a very abstract concept, but it makes total sense. If you look at chimpanzees, for example, the upper airway anatomy is such that the epiglottis, this is the top part of the voice box. The vocal cords are here, the epiglottis is here, and the soft palate. In humans, there's a gap between the two spaces, but then in chimpanzees, it's overlapping like this. Also, infants, when they're born, they're like this too. But what happens is that the voice box descends starting to around 3 to 4 months in children. So that's why you have this instability in infants around the 3 to 4 month mark. But this is what allows for complex speech language and articulation.
But a byproduct of that benefit that we gain from being able to talk is that we then are more predisposed to suffering from something like sleep apnea.
Right. And also choking and dying. Also, we're the only mammals that choke and die.
Well, I wanted to actually, I wanted to bring, on that somber note, I wanted to bring that up because it's not often that nature seems to make an obvious mistake, but I've always thought the fact that we have an airway and an alimentary canal that share a common pathway.
Yeah.
I've always thought that was very bizarre. We can all relate to coughing and spluttering after some food goes down the wrong way, but I'm just wondering from an evolutionary standpoint, is there a payoff? Is there a reason for us having that unified pathway for our alimentary canal and our airway, given that there is the potential to cough and splutter and choke? But does that outweigh the potential possibility of us actually choking to death?
Well, I would say yes, and let me explain. So the upper airway, as you said, serves three functions. Breathing is the most important. The second is swallowing, so you can swallow food and water. Third is speech and language. However, when the speech and language component overdeveloped, it compromised the other two. But I think you'll agree with me that complex speech language was fundamental to human flourishing and technology and intellectual development. So that was necessary. Then the brains got bigger too. But you could argue that up until about 100, 200 years ago, we had this nice equilibrium. Obviously, we had other factors for illness and death, like wars and famines, those kind of things. But now, with modern technology, there isn't that much environmental factors as much. And then, but what we did was we messed everything up by switching to a soft diet, so industrialized processed foods, artificial foods, convenience feeding methods like bottle feeding, and also the quality of our foods, because nutritionally, we're just not getting the right kind of nutrition and the vitamins that we need for proper bone and soft tissue development. And then we also have to add all the toxins and chemicals, the endocrine disruptors, even estrogen has been found to prevent jaw development too. And that's one of many chemicals in the environment and the water. Even another example is glyphosate. A lot of people don't know about this, but that weed killer from Monsanto. So I guess controversial topic for discussion, but it's been found to alter the development of what's called chondroitin sulfate, which is one of the molecules that's essential for proper cartilage and bone development.
Very interesting. Earlier, you mentioned the crowding of the teeth in the oral cavity. Wisdom teeth, for example, many people listening will have endured the discomfort of impacted wisdom teeth and then their subsequent removal. We are meant to have 32 teeth, but it just seems in recent decades, people seem to be having wisdom teeth removed constantly. Does this go back again to the changing of the skulls because of our diets?
Absolutely. So if you go back about 100 years, people for the most part did not need their wisdom teeth removed. And then if you go back to the more primitive cultures, for example, there's an author by the name of Dr. Watson Price. It's a pretty classic book that a lot of people talk about. He was a dentist that traveled the world in the 1920s and 30s. He and his wife was a nurse. They traveled all 5 continents, looked at these indigenous cultures. And they found that across the board, as long as they were eating off the land, so it could be off the mountains and the oceans and the jungles, and oftentimes just 2 or 3 food groups, not 4 food groups. They had perfect teeth and no cavities. They're very healthy environment.
Is this because of the nature of the food that we're eating, and because it's tougher when food is derived from the land as opposed to the foods that we would get in our supermarkets, for example, the processed food? Is it literally a case of it being tougher to eat more organic foods?
More natural, more healthier off the ground, but also how we eat it is also very important because it's not overly cooked or processed. So that concept of source to the table, just rather than going through a supermarket and processing plants.
You also made a fascinating observation in relation to our use of cutlery. That has also changed
Yes.
our bite, for example.
Mhm. That I know when I read this article, actually it was a book by B. Wilson called Consider the Fork. And it's a history of culinary tools in modern with humans, but there was one particular chapter she talked about overbites. So, and I looked this up in the literature. Over 100 years ago, even 200 years ago, people had what are called edge-to-edge bites. So the incisors are touching right in the middle. But modern people have an overbite like this. And what they did was they looked at skulls from in England and China. What they found was that the period before they had modern cutting tools, they had edge-to-edge bites. But once they introduced cutting tools, so the rich people had access to the cutting tools first, right? So the rich people were the first to have the overbites. And later on, like 100 years later, the peasants got the overbites too. And even in China, they had edge-to-edge bite in the peasant areas, in the poor areas in China, even up to the early 1900s, they had edge-to-edge bites. And now they have overbites.
It's amazing how behavioral change can give rise to anatomical change and so quickly.
Yeah, it's shocking that within a century we've made major drastic steps, and it's scary because it's getting worse and worse. That's what I'm seeing. Even from 20 or 30 years ago, it's much worse from what I'm seeing.
Although great news if you're an orthodontist.
It is, but the problem is that and they're kind of getting on board with the airway paradigm, but traditionally orthodontists had kind of ignored the airway for a long time, and now they're getting more interested. But for example, 20, 30 years ago, they took out the 4 bicuspids routinely. to to prepare them for the braces. And then later on, they got their four wisdom teeth taken out. So now you have eight teeth removed total. And these people are miserable.
It's extraordinary. Thankfully, I still have all of my own wisdom teeth. Talking about breathing, can we make the distinction between nose breathers and mouth breathers?
So it's critically important to breathe through your nose. So let me give you another historical point. There's a painter, I'm blanking on his name. There's a historical Civil War era painter who traveled the country after the Civil War and painted Native American faces. And what he noticed was that the healthy populations that were growing in the natural environment, eating off the land, had perfectly white faces, no cavities, similar to the Western price experience, no diseases whatsoever. But the ones that start to eat Western diets that much more narrow the faces, they were breathing through the mouth. So he wrote a book called, is it called Shut Your Mouth and Save Your Life, something like that? And so what they've shown is that if you breathe through your mouth, the face gets more narrow and elongated, and you have this, adenoid faces features. And so you have to breathe through your nose for the face to develop properly. And one of the other important factors of breathing through the nose is that the nose makes a gas called nitric oxide. It's a very important molecule. It got the Nobel Prize, I think, in the 70s. But besides all the benefits in the body, it increases oxygen intake in the lungs when you breathe it through your nose into your lungs. It's a vasodilator, dilates blood vessels. Okay, so you get more oxygen in your lungs when you breathe through your nose, as well as the fact that nitric oxide is antimicrobial, so it kills bacteria, funguses, and viruses.
Well, it's interesting. I read a very good book, a fascinating book a couple of years ago, written by a fellow Irishman called Peter McKeown. It's called The Oxygen Advantage, in
I
which
don't know.
you're familiar with it. Well, in that book, he spoke in glowing terms about nose breathing and actually exercising or running and breathing through your nose. And I certainly have done that since then because I found it to be, well, not instinctive. I certainly found it to be instinctive after a period of time.
A great example to give you is if you look at these elite marathon runners, and typically they're from the African countries, take a look at the finish line. The top African runners run the entire race with the mouth closed. And they're just kind of running through, like they're effortlessly just running without any strain or effort. But the American runners in the back are straining with the mouth open, like this.
No, it's true. It's true. You can see it whenever you watch any of these races. Can we talk about taping the mouth closed, especially overnight? I went through a phase myself a few years ago of taping my mouth closed. I did it for about 6 or 9 months. Now, I found it to be absolutely fine. It wasn't uncomfortable. Some people are put off by it and are afraid of doing it. They think they're going to suffocate. But can you talk to us about the benefits of doing this and about the implications it has for the teeth? Because I believe the tongue, whenever the tongue is in its correct anatomical position, particularly with the jaw closed, it means the teeth won't move around as much over a long period of time.
Right. I think it's a very simple maneuver that anyone can apply. It's not dangerous at all. Even most doctors still think that it's dangerous because you can suffocate, but I haven't heard of any incidents where someone suffered an injury as a result. Typically, what happens is if you do suffocate, you're going to wake up and you're going to take the tape off anyway. But most of these devices that you use for taping your mouth has a hole in the middle. What I do, I use mouth taping too. I go down the middle vertically to under the chin. So you still have the gap in the corners of your mouth to breathe through. Now, one key concept about mouth taping is most people think that you have to tape your lips together, and that's fine because the whole point of this is to keep your jaws closed, not your lips closed. Because if you open your jaws even just a little bit, what happens is that the tongue goes back more. So in practice, I did a lot of what's called drug-induced sleep endoscopy. When I take a look when they're sleeping and you open the jaws a little bit, the tongue goes back severely. So that's why it's important to keep your mouth closed, not just your lips closed, but your jaws closed together. So if you just tape your lips together, you can still open your jaws. See that? So what I did was, if you go down the middle here and you go under the chin, you suspend the jaw just a little bit more. It's not perfect, but it's much better than doing this.
And the benefits then to sleeping then with your mouth closed as opposed to mouth breathing overnight.
benefit is that it keeps your airway more open behind the tongue. Because anatomically, when you open your jaws, the tongue rotates backwards and it obstructs the palate somewhat too. So it causes more breathing problems.
And would this lessen the symptoms then if somebody had sleep apnea, for example?
Well, you don't even have to have sleep apnea because one of the points I make in my book is that all modern humans are on a continuum, and only the end spectrum is called sleep apnea. But even if you're relatively healthy, you're going through phases in your life. For example, if you gain 5 or 10 pounds, you go up that continuum. If you're pregnant, you're going to go up that continuum. Even if you have a cold temporarily for 3 to 5 days, you're going to go up that continuum temporarily.
In your book, you have a whole section on the sleeping position. What is your advice in relation to this?
So my advice is whatever you're most comfortable sleeping in, stay there. But don't follow doctor's advice to sleep on your back. For example, dermatologists are telling women don't sleep on your stomach because it causes facial wrinkles. You see that a lot in these women's magazines. So, for example, I had a case where it just happens like once every couple of months. Middle-aged woman comes in with, let's say, 6 weeks of fatigue, sinus headaches, poor sleep, anxiety, depression. And she says that I have a sinus infection. And I examine her, everything is fine. And I ask her, do you sleep on your back side or stomach? She says, I sleep on my back. But based on her anatomy, I don't believe her because with that anatomy, she just can't breathe properly on her back. I asked her, so when you were younger, when you were a teenager, how'd you sleep? Oh, on my stomach. When did you change? About 7 or 8 weeks ago. Why? My dermatologist told me not to because it causes wrinkles.
Extraordinary.
So, sorry, let me just add one more thing.
Yeah.
Problems occur when you're prevented from sleeping in your preferred position. So, for example, if you undergo an injury, so let's say you're a side or stomach sleeper, and you get injured or undergo an operation, now you're forced to sleep on your back, and then that's when everything goes downhill.
Okay, so the best position is the position you're most comfortable in then.
Right. And if you're not sure, experiment.
Melatonin, a lot of people rely on this in various parts of the world to help them sleep. It is a sleep hormone, but I've heard you speak about it in the sense that it has more than one function. There's also an element that it helps to reduce the level of gastric reflux. Is that correct?
Yes, it has tons of lots of different benefits besides as a sleep hormone. What it does is it lowers acid secretion and insulin. It also tightens the lower esophageal sphincter to prevent reflux. Another major benefit is, and your audience may know something about this, that sunlight during the daytime activates melatonin production in all your body cells by the mitochondria. And melatonin is a powerful antioxidant. So it increases more efficient energy production by the mitochondria.
Now that I didn't know. Interesting, very interesting. Can I ask you, how do we know we have a sleeping problem, especially in the absence of having a bed partner, for example? So if people are sleeping on their own all the time, how do they know they have a sleep problem?
It's basically how you feel and function during the daytime. So let's say that you could sleep 8 hours straight without waking up, but you just never feel rested when you wake up, or maybe during the end of the day, you're not as refreshed or you can't focus as much as you used to be 5, 10 years ago. And so typically you'll go through the steps of going to your doctor, make sure all the blood tests are okay, and everything comes back normal, but you're still not feeling well. You know something is wrong, but no one can give you an answer. And so that's when I kind of question people about their sleep habits, and sleep position, nasal congestion, all the basic principles to improve your breathing through your nose and your throat. And then if that doesn't work, actually I would say about a quarter to a third get complete relief just from the conservative principles alone. For example, not eating late, not sleeping on your back, making sure you're breathing well through your nose, keeping your mouth closed. But then you have to kind of go up that ladder into more a formal option. So go to a sleep doctor or an ENT, maybe get a sleep test and kind of move up that ladder.
Another practical piece of advice that you gave in relation to people who are having difficulty sleeping and especially waking up at night is not to drink before going to bed. And you told a very interesting story about this. Apparently, it's got something to do with the heart. Whenever you have a fluid in your bladder, the heart is enlarged. Could you tell me about this?
Yeah, this is a very, very important concept, and it's nothing new. It's been in the literature for decades. So what happens is when you stop breathing, when you have an apnea, You breathe in against a closed throat. So you expand your chest cage and it creates this negative effect, this vacuum effect inside the chest cavity. And what happens is that the heart cell, the heart muscle also expands as a result, kind of like if your lungs expand. But the heart thinks that there's too much blood coming in. So it creates a hormone called atrial natriuretic peptide that goes to your kidneys to make you make a little bit more urine to get rid of the fluid. So if you have multiple apneas throughout the night, you're going to produce a little extra urine. And typically, if you wake up in the middle of the night, it's going to be around 3 a.m. That's the most common time people wake up. And if it's more than once, it'll be about 90 minutes apart in the other direction. And so typically when you wake up to go to the bathroom, you think you have to wake up because you have too much urine. But what they've shown in studies is that the reason why you wake up is not because you have too much urine, but it's because you stop breathing and you think you have urine to eliminate.
That's
And the thing,
extraordinary. Yeah.
everything about this is called nocturia, nighttime urination. Oftentimes, if you take care of this breathing problem, the nocturia goes away. It's pretty remarkable how, and for example, children who bedwet, after you take out the tonsils, the bedwetting goes away completely. But one interesting thing about nocturia is that they've done studies showing that if you go to the bathroom 2 or more times per night in adults, in women, I think there's a 50% increased risk of dying for all causes. It could be heart attack, stroke, cancer, accidents, whatever. And for, I think, young men and there's certain demographics, it's more like 90% higher risk. So nocturia is not something you should laugh at. People, for example, men blame it on enlarged prostates, but even people with normal prostates have nocturia, which goes away when you treat the sleep breathing problem.
Okay, Dr. Park, before I let you go, just a recap of some of the practical things then that we can do in order to improve our breathing and get a better quality night's sleep.
Sure. Number one, which we mentioned before, is no eating or snacking anything within 3 to 4 hours of bedtime. And there's a lot of scientific studies proving why that's the case in terms of your digestion and your hormones. But my main point is that you don't want any stomach juices lingering when you go to sleep because it's going to come up when you stop breathing once in a while. Number two is just reassess your sleep position. Go back to how you slept when you were much younger and you slept much better. And if you had some kind of injury, that may have been the point at which point you had to sleep in a different position. So kind of think about when you made that change. And also your neck position, even if you're on your backward side, try to keep your neck from bending forward. So this is why you have the contour pillows that do this, helps with snoring and sleep. Because when you do this, it opens up the airways somewhat. Okay? And then number four, make sure your nose is really open. So a lot of people, they may not have any nasal congestion, but at night they get congested because they're flat and the tissues get filled with blood. So do everything possible to improve your nasal breathing. So addressing allergies, use breathe right trips. You can use nasal sealing irrigation, maybe even go see an allergist or an ENT to address your nasal congestion. Okay? And then consider mouth taping. And then some other tips that I recommend is don't use any screens, electronic screens, 2 hours before bedtime, because that's when your melatonin levels start to go up. If you use screens, it kind of delays the onset of melatonin. And then on the reverse, in the mornings, get as much sunlight into your eyes as possible, especially during the day. We don't get enough sunlight in general. That's why most people are very vitamin D deficient.
Well, some great advice there. Dr. Stephen Parker, author of Sleep Interrupted. Thank you for joining me today. Appreciate it.
My pleasure.